Hey everybody, it's your anatomy and physiology teacher, Mr. Poser. Today we're getting into our second video in the respiratory system series, and we're talking about the lower respiratory tract, which includes your trachea, the bronchial tree, which is are the two branches of the trachea that branch off into each lung, and of course the lungs, and the alveoli, and the super important components, microscopic components of each of the lungs. All right, so we'll walk in a little bit more into the anatomy of each one of these. All right, so we're just going to start with the trachea because we left off with the larynx. So the further we go down the respiratory tract, there we're going to find the trachea. So the trachea, its job is to obviously connect the larynx with the bronchi, which are the branches of the tree that branch off into each lung. And here's another point about what I was talking about in the last unit, the last video. The trachea is lined with what we call ciliated mucosa. Okay, so ciliated means that there's little tiny hairs on the surface of each of these cells, or what we call the apical surface, the side that faces the faces the air that's coming in, or the opening in the trachea. Right, so it's ciliated, meaning it has those hairs, and it's lined with, and it's called mucosa because it lines it with mucus. Right, so here's that second bullet point. It says it expels mucus loaded with dust and debris away from lungs. the lungs. There we go. But yeah, that's the whole job of that respiratory mucus, is to trap debris and dust so that it can be brought away from the lungs, and that gas exchange can occur more efficiently. The cilia, these little hairs, they beat continuously in the opposite direction of incoming air in order to get rid of that stuff that should not be in your lungs. Okay, so yeah, the only thing that should be in your lungs is air. And your body tries to make sure of that. The walls of the trachea are reinforced with hyaline cartilage, and it prevents collapse. Okay, so if you can kind of feel it in your trachea, there's little rings of cartilage. If you were like really feel in your neck, I can, because I have a protruding trachea here, but you can kind of feel it, that there are rings of hyaline cartilage, and their job is to make sure that the trachea stays sturdy. Okay, the constant change in air going in and out causes a big change in pressure. Okay, so when you are breathing out air, you are reducing the pressure in your, you are increasing the pressure quite a bit every time you breathe out. And if your trachea were not reinforced by hyaline cartilage, if it didn't have these rings of hyaline cartilage around it, then the trachea would collapse in on itself. Okay, if it was just like this rubbery tube or whatever, it would kind of collapse in on itself, and it wouldn't work in the way that it should. Okay, so yeah, that's why the trachea needs to be reinforced with hyaline cartilage, because it prevents collapse. Okay, the trachea, the windpipe as it's often called, as I said, it branches off into two different directions that go towards each lung, and each of those branches are called the primary bronchi. Primary meaning first. Okay, so these are the two main branches of what we call the bronchial tree. And the primary bronchi, their job is to divide into right and left from the trachea, and they enter the lung at the hilus. Okay, so the depression or the opening that the bronchi enter the lungs into is called the hilus. The right bronchus is wider, shorter, and straighter than the left, and each of these primary bronchi subdivide into smaller branches, which are called bronchioles. Right, so we were talking about in our last unit how arteries branch off into arterioles, bronchi branch off into bronchioles. Okay, so if you have bronchitis, okay, you have an inflammation of these bronchi, these two branches of what we call the bronchial tree that breaks off from the trachea into each lung. Okay. So those are the main two branches of what we call the tree. Okay, you see why it's called a tree? Like, check it out. If I rotate it, oh, it's a tree, right? So the trachea is the trunk, and then the bronchi are the branches. Hey, that's kind of easy to remember. But anyway, the bronchioles, as I was saying before, these are the subdivisions, smaller tubes that branch off of the primary bronchi. So these are what we call the smallest branches of the bronchi. And there's another term for the bronchioles that end with these alveoli, which are the areas of gas exchange that occur. So this is really where your blood connects with your, or your cardiovascular system connects with your respiratory system, is the alveoli, and that's what we're going to get into next. But here's our bronchial tree one more time. Let's just flip it upside down just so we can see a tree. Oh, look at that. It's a tree. Here's the trachea, primary bronchi, it branches off, and here are the bronchioles. It just kind of branches off and branches off and branches off and branches off, okay? And so there's primary, secondary, and tertiary. The bronchioles, the terminal bronchioles, are like the final destination of air entering the respiratory system. Okay, so that's where it really wants to go. And at the end of those terminal bronchioles, they have the alveoli. And what are alveoli? They're the site of external gas exchange between oxygen and carbon dioxide, between the blood and the air, pretty much. Okay, we call this external gas exchange because it's really air from the outside is getting in, and then that's where the gas exchange occurs, as opposed to internal gas exchange, which occurs between capillaries and tissues in the systemic loop. Okay. So remember from last unit, there's your pulmonary loop and your systemic loop, right? So external gas exchange occurs in what we would call the pulmonary loop, and then the internal gas exchange occurs in the systemic loop. All right, so remember when we were talking about the heart, it would be like, okay, the pulmonary arteries are taking blood over to the lungs, and the pulmonary veins bring it back. What happens in between there? Well, there's capillary beds that are surrounding these tiny, tiny little sacs of air called alveoli, like microscopic sacs of air that are all over your lungs, called alveoli. Okay, and they're super thin, and just like the capillaries that surround them, they are designed for gas exchange, and they allow for diffusion of oxygen and carbon dioxide. This is where the magic happens here. Okay, this is how oxygen from the air is able to get throughout your entire body. This is the drop-off point that it gets into the cardiovascular system. It kind of looks like this. There's like a web of capillaries around each one of these tiny little air sacs. Okay, that's what the alveoli are. Okay, so your lungs themselves, obviously they're the main respiratory organs. Okay, some misconception that we want to address right now. A lot of people think your lungs are kind of just like these open sacs of like balloons almost, that are just kind of like empty, and then air comes in and they just blow up like balloons. That's not true. They're more like spongy, right? So here's an anatomical. This is actually somebody's lungs, or the insides of somebody's lungs with the covering taken off. It's not the highest quality picture, but take a look how many how many bronchi and bronchioles there are within the lungs, and on each one of these, there's bunches of alveoli. So really, your lungs are more kind of like this spongy kind of feeling, and they're not even close to being like empty balloons like many people think they are. They're kind of just like these sponges that fill up with air. Okay, so yeah, here's another picture of some recently transplanted lungs. Or this is actually a whole respiratory system. There's the trachea, and then yeah, sorry if that was. I should have maybe had a warning there about the about the bloody respiratory system there. But yeah, this is what it looks like. It's not like this empty. It's not like these empty balloons or anything like that. It's kind of spongy. So the lungs occupy most of the thoracic cavity. They're pretty big, right? The different parts of the lungs, you have your apex, which are like the most superior points. They're near your clavicle, so they're actually like up here. And the base of the lungs rests on your diaphragm. So they're pretty big, right? Each lung is divided into lobes. Each lung has lobes, different sections of it. The left lung has 2 lobes, and the right lung has 3 lobes. Okay, the left lung is a little smaller than the right lung because the left lung is really, well, it's got to make room for the heart, okay, because your heart actually kind of tilts to the left. It's not right in the middle here. It's on your left. That's why you raise your right hand when you're, singing the national anthem or something like that. Okay, you put your hand right there and you can feel your heart. It's on the left side. That's why your left lung only has 2 lobes. It's a little smaller than your right lung. Okay, last thing we're going to talk about in this video are the lung coverings. Okay, so your lungs have several different layers, membranes surrounding them, and that serve some important functions. And those larynx are called the pulmonary pleura. So there's that word again, pulmonary. And pulmonary refers to lungs. Pleura refers to the layers that cover the lung surface. There's two pulmonary pleura. There's the visceral pleura and the parietal pleura. The pleural fluid fills in the area between those two layers. So take a look at this picture here. Here's your lungs, right? But then you have your parietal pleura, pleural space, which has pleural fluid in it, and then your visceral pleura. So you have different coverings over the lungs that are fluid filled. And why might they need to be fluid filled? Well, that's going to reduce friction between tissues and avoid creating unnecessary heat. And it provides like lubrication for the lungs to move in and out, because they kind of change size every time, or volume every time you breathe in and breathe out, right? So also in those pulmonary pleura, there are macrophages, which are types of immune cells that ingest foreign particles, right? So your lungs have this own kind of immune defense, these special kinds of immune cells. We've talked about them before, but just as a reminder, these are the cells that will go up to something and put their cell membranes around it and basically just swallow it and digest it. So there's your immune system protecting your lungs. And then finally, there's one more term that we're going to talk about when it comes to lung coverings. There's surfactant on each of the alveolar surfaces, and it coats the alveoli in order to make sure it kind of lubricates it and makes sure that gas exchange can occur. It has a nice like watery kind of medium for gas exchange to occur in. So yeah, that's what your lung coverings do, and that's what surfactant does. Take a look at this picture down here. We have lungs with various diseases in it and what they look like. So here's mesothelioma. It's cancer of the pleural coverings. That's what mesothelioma is. You have this person has plaques on their diaphragm. Take a look. There's that big diaphragm. It's like this dome-shaped muscle that allows you to breathe in and breathe out. We'll talk about it in that next video. Asbestosis is scarred lung tissue from breathing in asbestos. And you can develop pleural plaque that leads to hardened pleura. So these are asbestos-related diseases. But yeah, asbestos, it's a class 1 carcinogen because it can cause all 5 of these different diseases down here. All right, so yeah, in the next video, we're going to get into breathing mechanics and respiratory mechanics. So let me know if you have any questions. We'll see you next time.